Fantastic. Then there we go. Now we're recording. Welcome, everybody. I'm Peter Padilla, and I am the Mayor Pro Tem from Brighton and am serving as the chair of this council. We have as the members of the council today, well, I guess I'm calling us to order. Here's the agenda in front of you. We're going to talk for a few minutes about who is now on the council because we've had some changes in personnel. We're going to get some updates from what's happening with previous grantees, money that's been spent to date. We're going to take a look at amendments to extend out and continue some of the funding from our first cycles. We'll take a look at what funding is now available to us, and then take a look at the many applications and our priorities that we issued when we put out the RFP for those. We'll have a chance to discuss those recommendations, those applications, make a determination how we want to proceed as a council with that funding, and then talk about the next steps, which are largely administrative, but working with the council, with the Adams County Commissioners, because our contracts are issued through Adams County. They act as our fiscal agent. And then we'll have an opportunity for any additional public comment at the end of that time frame. And then I think, okay, there we go. So this is who we have with us on the council today. We can go in this order if you want to comment, but I'll just introduce who's on the council and who we have with us today. Obviously, you just heard from me. New to our council, our county commissioners. We have 2 seats on the council for county commissioners, and you just heard from Julie Duran-Mullica a moment ago. I'm so excited that she is here with her public health background and knowledge in that area. Anything else you want to say, Julie? I may have caught her with the chance that she got a chance to eat at the same time as we're having this meeting. We'll also be joined by new County Commissioner Kathy Henson, and she'll be on shortly. Doris Peterson is Mayor Pro Tem from Federal Heights and is one of our 2 municipal representatives on the council. So glad that you're here with us, Doris. Doris has been with the council since its inception. We now have the police chief of the Commerce City Police Department representing law enforcement on our council, and that is Chief Daryl Guadagnola. And he is backed up by Chief Jim May from the Northglenn Police Department. He's been with us for a little while. Welcome, Chief. We also have Tim Twinings from the District Attorney's Office. So although this is the Adams County Council, we are about half of the 17th Judicial District, so that organization gets to be represented both here and with the Broomfield Council. I don't believe that we have our chief judge with us today. Is Judge Seedorf able to join us today? You know, Ashley?
He was not. He sends his regrets. But we do have, I think, maybe some of these other folks helping on, but we have both these folks already on, which is great.
Fantastic. And then Dr. Kelly Weidenbach, who is the executive director for the Adams County Health Department, is the much more capable vice chair for this council and offers much more wisdom than I am able to bring to the organization. So Kelly, I'm very glad that you're here today. And then we have a few alternates. We did mention Jim May, Mayor Pro Tem from City of Thornton. Kathy Bigelow is the alternate vote for the municipal representatives. Levon Hupfer, who actually was a member of this council for the 17th Judicial District, but switched jobs over to the Adams County Health Department, is the alternate for our health department representative. And then Simone Jones is the alternate representing the judicial district courts when that's. Isn't Glenn Robinson also a member of the council from social services?
We had heard that he had moved on from his role, but are working to confirm exactly what that looks like.
Okay. but no matter where it's at. But we do have a quorum of this board in attendance, so I'm very glad that you all are all here. For all of those who are observing, this is the group of people who will be able to cast the votes when we get to that step. Do we also have an introduction for the people who were on our advisory committee? Or is that not part of today's agenda? I'll let you
Well,
move to the
we
next
will share
slide.
our vetting committee and who's on that vetting committee a little bit later
At the
when we start
appropriate
to get
time.
to the recommendations.
Excellent. Okay, so then Ashley, I will turn this over to you and Ben for some updates on things that are happening.
And Ben, I'm going to let you rock and roll here. And just for the record, for folks who may not be familiar, my name's Ashley Leidinger. I work with Rocky Mountain Partnership Cradle to Career. My colleague Jody is normally the person you see on these calls, but she's currently out on maternity leave, so I'm filling in her spot here. And then Ben from our team is also on. We're responsible for providing support to the Adams County Opioid Abatement Council behind the scenes and through the application and all of that process. A big part of that includes data, tracking progress and impact of these dollars, and helping the council use data for decision making. So great to see you all. Ben, I'm going to turn it over to you if you want to just super briefly introduce yourself and then also give some of these quick updates.
Thank you much for the handoff, Ashley. Hi, everyone. My name is Ben Nash. I'm the Information Insights Manager with Rocky Mountain Partnership. So I have been primarily in Jody's absence along with Ashley, sort of consolidating a lot of this information for presentation to the council. And I know we have a lot of big decisions, tough decisions to get to. So I will try to get those pretty quickly, but a few quick updates for the council that have arisen over the last 6 or so months. First update is we have an opioid grantee community of practice coming up on the 2nd of June. This is something that the opioid grantees have been asking for a while now, and we're bringing them together and have sent out a Google form asking them sort of what areas of focus they would like to discuss in that meeting. So we're very excited to be hosting that. We've also continued to investigate to dive further into interregional collaboration and any opportunities that are there moving forward. We've actually had a few preliminary meetings with Region 10 to discuss sort of what the distribution of sober living facilities looks like across our region, their region, and then our next step with them is actually to start diving into a few of the applications they received around sober living facilities to better understand if there's any of them are sort of ripe for collaboration between both of our regions. We've also continued to attend the Front Range Regional Facilitators cohort meetings and brought that conversation there as well. So effort still relatively nascent, but headway is being made in that regard as well. And then the two last quick things are we will be scheduling some follow-up time with all of you to dig further to sort of highlight data a little bit more deeply, dig further into the progress that has been made, and hopefully get that time on with you guys in sooner rather than later, just because we want to be able to leave as much time today for a robust discussion around the applications that we received. And then the very last thing is I actually just got this call from Jack at the Attorney General's office right before we hopped on here. But they are curious if we would like to be, in previous years, they had regions sponsor the Opioid Abatement Conference. They are asking us if we have interest in doing that this year, something we can revisit in the future as well. But I wanted to put this on your guys' radar, just so you're aware of it. They would be asking a roughly 5 to 10K contribution as sponsorship. It would involve a speaking role during the greeting and more specifics to come.
Thank you. I would comment on that we have been invited and have been active participants in each of the conferences to date. And the Attorney General's office has called us out as positive examples for the other councils to emulate, particularly looking at our processes for prioritization, for application and review, for award, and for tying the performance to best practice and evidence-based practice. So I think the fact that we have been a model agency or council for the remainder of the state from the Attorney General's perspective, this would be a good opportunity for us to consider.
And I can follow up with Jack at the AG's office as well to get some more information for the next time we come together to make an official decision. But just wanted to put that on your
Excellent. Do you know where this one is?
This will be in Loveland.
Okay. Fantastic. Any questions on updates or comments from staff?
I have a quick question. Have we done this before in the past? Sponsor this conference, or would this be a first time?
This would be the first time that we would be sponsoring.
Okay.
We have been part of panels at the event before.
Oh, nice. Okay, cool. All right, just curious about some background. Thanks.
Excellent. I see you've grown a second head, so welcome to Commissioner
I
Henson.
do have a second head. And she got glasses too. And glasses.
Indeed.
Hello, everyone.
Thank you. I'm glad that
Sorry,
you're
I'm
here.
late.
No worries.
Thank you.
Okay, Ben, I think we can move to the next.
Ashley.
Yeah,
Yes,
thanks.
ma'am.
Thanks for passing it off, Ben. We are going to review the progress and impact of previous grantees from cycles 1 and 2 more in depth. But I did want to let folks know that across our cycle 1 and cycle 2, we have been getting some really good data from our grantees, which is being visualized and made available through the interactive opioid data hub. We'll reference specific impact to date when we get to some of the renewal applications for those specific grantees, because I know that is something the council has been super interested in, is as we continue to fund grantees for an additional round or some additional dollars, that we're making sure that they are having the intended impact that they set out to have. So we'll highlight those folks, and then for everyone else, we'll dig deeper into what that data looks like for everyone else at that next session that gets scheduled, just so that we can focus on applications today. Any questions from folks before we start to dive into some of the business for today? Fantastic. Ben, I'm going to pass it back to you to provide some information about the budget amendments from Cycle 1 and Cycle 2 grantees.
Just comment that is the most consistent question that I'm getting from outside folks now is what have we spent money on and what's happening with that to date? And are there some numbers that are starting to come together with the number of people exposed to, impacted by those dollars? And certainly the fact that fentanyl deaths have gone down overall is bringing people back around to asking those questions. So the more we can start to see in terms of dollars from cycle 1 and cycle 2 and some numbers, the better.
And I think that's why we want to get on turn around very quickly and get back on with you guys to sort of go through some of those numbers. Ashley, can you click to the next slide? Perfect. A few things, but yes, thank you for lifting that, Peter. A few things regarding specific budget amendments. I think this can probably be pretty quick as well, because I know we want to get into the meat of the conversation today. So a few just updates for you guys for the most part. So no cost extensions. I know we discussed this in previous sessions, but we sort of tried to move away from having the rigid structure of a specific like 1 or 2 year spending period, because we were finding that a lot of grantees, the reality is standing up good quality work just takes a little bit longer than that. Sometimes, especially seeing impact being done by that work definitely takes longer than that. And so we've had a number of grantees reach out and ask us about continuing to spend money beyond what their original contracted spending period dictated. Some of those are CU Anschutz, Yes Institute, Thornton PD, Adams 12 5-star schools. So that's just an update for you guys, something that you guys have actually already okayed in the past. And then the only tangible budget amendment that I think requires a vote today, because it represents more than 10% of any one budget line item, is actually Adams County Health Department. So we have 2 separate requests from them. One is to move $2,000 from the software licensing to professional development budget, resulting in $3,200 in professional development and $3,000 in software licensing. And the other is a reallocation of funds from the existing education and outreach budget in round 1 of the opioid abatement grant to the purchase and operation of a harm reduction van. That represents a more significant funding shift of $135,000. And I can speak a little bit to, give me just a second here, why that. Adams County Health Department would like to request the reallocation of funds from the existing education and outreach budget for the harm reduction van. As our community continues to grapple with the devastating effects of the opioid crisis, and other substance use disorders, we must take proactive and evidence-based approaches to mitigate harm and save lives. A harm reduction van would serve as a mobile outreach unit, providing critical services to individuals in need, including sterile syringe distribution, naloxone access, overdose prevention education, wound care, and linkage to treatment and social services. Does anyone have thoughts, considerations, before, Peter, we eventually bring this one to a vote?
So the first comment on the first issue on the extensions, I will mention that in our last meeting, so that was before a fair amount of the shift in membership of the council, we did make the determination that we wanted to allow people to take the best possible advantage of the funding that we had given them. And rather than having come back, return their funds and make a new application to come back the next year, as long as they were making progress in the arena that we wanted them to do and were performing to expectations, then we would allow them additional time to spend those dollars. So we may come back with round 2 dollars and have the same requests from people and make the same determination. So that's why that one doesn't require an action today. First, there's no new investment, but second, the previous council extended the term for them. Let me just reiterate as my understanding and clarify this for the Adams County Health Department. One, this is for shifting funds from one focus area from education and prevention into our harm reduction area, but is not a change in total dollars, correct?
That is correct.
And it does shift the dollars into one of the areas that we determined last year to be one of our most significant gaps, and that is active and mobile harm reduction. So it does move it into something that we had not previously been able to fund as much as we had actually targeted. So it actually helps us to come more in line with our target goals for funding for the health department to move to this harm reduction method, and making that capital purchase also fits with some of the previous goals. So I certainly would be supportive of that from my perspective. Any other comments or thoughts from members of the council?
Gerald, no, I'm sorry, I'm new here, so maybe this has been discussed or revisited. I'm just curious. I'm feverishly trying to go through some of this packet that we received last night, but I see there's a lot in these packets about what success looks like for this request. Is there anything from the health department with regard to what success might look like? I would assume when they were previously granted this $135,000, there was something that talked about what success would look like. Is there any similar discussion or similar documentation in that regard for this before we move forward? Because I would be curious if this was previously awarded under the banner of here's what success looks like. I would think the same would exist if they're reallocating funds to something else.
Ben, if it's specifically listed in the application, I'll give that opportunity. And if it's not in there, then Kelly, I would give you the opportunity to answer as well.
I am looking for something that speaks directly to that. They submitted a letter along with this that has some language. Numerous studies and models from other cities have shown that harm reduction efforts significantly reduce overdose deaths, prevent the spread of infectious disease, and build trust between the public health department and marginalized populations. By reallocating funds to this initiative, we would be making a tangible, immediate impact on public health and safety. That's probably the closest thing to a direct impact statement that I can find in the letter.
Ben, I'm wondering if you share the KPIs that they've committed to track, because that will share like that they're actively tracking, because that will share some of the progress and impact that they're hoping to track and are actively tracking in this space.
Yeah, let me try to pull those up 1 second. While I do that, I think we have
Yeah.
some other.
And Ben, while you're doing that, I can also help answer that question a bit. I actually don't think our measures of success will change for this. It's just an issue of like reallocating the funds to help us do the work better and more easily. The van would help us facilitate outreach in a way that, just from lived experience from the past two cycles, learning what is working and what's not in terms of our outreach efforts, the supports that our staff need to physically move large amounts of material around the county. So I don't believe there's any planned change in our KPIs or metrics, or really like the outreach and the target outcomes would not change. So
The
just
KPIs that are at a higher level than here's how many people come in direct contact with the van.
Yeah.
So it remains education and outreach focused, just in a different vein. Is that fair to say?
Technically, it moves into the category of harm reduction, but yes, it's still an outreach effort and would be rather than upfront education on a la Nancy Reagan, don't say no. It's in the range of people who are already at risk for harm and intervening.
Thank you.
Julie, I see your hand raised, and you were very patient as Kathy blinked on your behalf.
No worries. You know, Daryl, I think that that's a great question. Thanks for asking that, because I think it really just makes this, we want to make sure that this money is being used right for the intended purposes of what the original grant was. I think that, yeah, I would support this transition, because I think it still gets at, you know, the education and outreach that Adams County Health Department would still be able to do. So, well, Kathy, if you want to add anything, you're welcome
No,
to.
I agree. I agree. I think it's a good use of the funds.
Okay, any other questions? With that, other questions, I'll entertain a motion to approve that budget change for Adams County Health Department.
I'll move to approve the budget change for Adams County Health Department.
Thank you. We have a second for that.
Okay.
There we go. Okay, and all in favor of approving that change in budget request?
Aye.
You can raise your hand, you can signal yes, you can, I think there are voting buttons available, reaction buttons. But I've heard a few yeses. Are there any nos? Okay, none opposed, that's approved. Then we'll go ahead and move on. Thank you.
Ben, this is still you, I think.
Yes, it is. Next slide, please. Awesome. So just a very quick recap before we start actually diving into the applications. Much of this information will probably be reviewed for a number of you. But so far, between all...
And let me just make note that Dr. Weidenbach, as representing Adams County Health Department, did not vote on that approval. She did recuse herself from that vote for having the dual role of applicant and council member. Just want to make sure that's in the recording.
Appreciate the
Go
note.
ahead.
Thank you so much.
Thank you.
Okay, so anyway, this will probably be reviewed for a number of you, and we'll get through it pretty quickly. But through these first 3 rounds of funding, we have received from the AG's office roughly $14.5 million to date. Between cycle 2, where the council elected to reserve about $3.5 million for these targeted interventions that we put an RFP out for, where they reserved about $3.5 million. And the roughly $4 million that we requested additionally from the AG's office, we now have about $7.5 million to distribute in this cycle. With that said, in this cycle, we received $12.5 million of requests. So like I mentioned before, some hard decisions will have to be made. And with that said as well, keep in mind something we sort of harp on every single time we come together. The council is committed to funding extensions on a rolling basis as well moving forward. And we want to make sure that we are providing sort of a balance between funding sustainability and ensuring these organizations that have received money to do their work are able to continue doing their work, but also ensuring that the organizations themselves have their own plans for sustainability. So with that said, we want to ensure that we have funds reserved to continue funding extension applications on a rolling basis, as well as new and emerging efforts like interregional collaboration. So just something to keep in mind as we're going through.
I'd underscore that and add to it that the amount of money that we receive each year based on these settlements is not necessarily consistent. It varies a little bit based on the number of settlements that are in place, the duration of those settlements, and if some of them are front loaded or some of them are back loaded. So taking a look at our average so far, it's been about $3 million a year. That's not necessarily guaranteed to be consistent all the way through. We've also made a determination a couple of years past to finish doing some analysis of where do we have gaps in Adams County where there are no services that address those gaps at all, and make sure that our requests for proposal are fed in to meet those gaps that don't exist in Adams County and don't exist in the regions that adjoin us. So that's part of why we had that additional $3.5 million is over the last 2 years, we've held back a little bit of money to have available for specific purposes. And then knowing that in many cases, we're not just seed money expanding existing programs, we're the money that's creating programs that don't exist in any way, shape, or form. And those don't necessarily take hold and gain stability and gain other funding sources over the course of just 1 year. So we want to make sure that we are able to keep those sustained and moving for as long as it takes to have them be consistent. So that's why we would not necessarily want to make sure that we put every dime we have out the door in 1 day. We want to make sure that we can keep things rolling. Okay. And I think that's going to roll us into, what do we have now? What do we have requests for this year? And do you have some process introduction to that as well?
I do. I'm very excited because I know this is the meat and potatoes of what you all are here for today. Although I'm excited for us my area that I really love is the data piece. So I'm so excited for us to do that deep dive here pretty soon. But I did just want to give a quick overview of our cycle 3 funding requests. And I think okay, there we go. In the cycle 3 application process, which was open from, I believe, January through March, we received 30 applications totaling $12.5 million in asks. This included a mixture of previous grantees who were seeking additional funding, which we're calling renewals. We've realized that the term extension is a little confusing because typically that is associated with a timeline extension versus or allowing more time for funds to be used versus an additional dollars. So internally we started calling it renewals, but you all can call them as a council what you would like. And then a mixture of new applicants, and there were quite a few new applicants, hence why we received 30 applications. We received funding requests for all 4 of the prioritized areas identified by council. For folks that may not be familiar, our chair, Peter Padilla here, just shared a little bit about what that process has looked like of being very intentional with RFPs moving forward. There was a group, and this group still exists, called the Key Driver Work Group that really dug into the data and made some clear recommendations on what the focus of the cycle 3 funding should be, knowing that there are a lot of needs and gaps in Adams County, but how do we prioritize this next round of funding on some of those pervasive gaps? Not to say that there aren't still other gaps, but this is where they landed in this round. And those 4 areas were medication-assisted treatment, so MAT treatment, youth intensive outpatient, peer support systems, and workforce and training. The process for vetting these applicants.
I'm sorry, let me back up just a second and add, Ashley, to that there are about 7 areas, and I never get all of them exactly right, that are specifically outlined as areas that we can fund. So prevention and education, law enforcement, harm reduction, ongoing treatment, and ongoing recovery are the ones that are coming to mind. I think I've covered the most of them. So we can fund against any of those priority areas. The ones where we had the biggest gaps in the county, within those are specifically these four that were called out as priorities. So that's where we put out the RFPs for this year, saying, although you can ask for anything in any of those larger areas, these are the four where we statistically see the largest gaps and the biggest need for this year.
Thank you for that context, Peter. And Ben, is there anything you want to add there? I know you're kind of the master keeper of all the information about all the approved uses and everything.
No, I mean, I think Peter gave a pretty good overview of sort of what our rationale was, why we landed on these four. They just continue to be pervasive. Yeah, thanks, Peter.
Great. With that, I do want to talk a little bit about the process that has happened in terms of vetting the applications that were received. In addition to the key driver work group that we have, which is a mixture of content experts, grant recipients, and folks who are not grant recipients, just so that we have a robust understanding of what's happening in our community. We separately from that have a grant vetting committee. And this rounds committee was made up of Ann Wilford with the CSU Prevention Research Center, Jennifer Place with Colorado Consortium for Prescription Drug Abuse Prevention, Haley Klein, who's a drug user health specialist, and Dr. Jason Hopp, who is with emergency medicine at CU Anschutz. Variety of content experts with a variety of different areas of expertise in these specific areas that the council focused on this round. There is a robust scoring matrix which was made publicly available during the application period. The specific criteria that these applications were scored by the vetting committee off were based on the following. One, do these applications clearly identify the outcome the proposal is intending to impact? And is it tied to what the council is looking at through their interactive opioid data hub in terms of opioid related outcomes? Are there clear, measurable, and reasonable targets and metrics to hold accountability to the impact that they've identified? So are there actually measurable goals that they have in place and clear metrics that they're going to use to track progress and impact? Has the proposal been demonstrated to be highly effective or promising and emerging? This is where some of the evidence-based component comes in into assessing applications. We've demonstrated to address one of the prioritized gaps, or if it was a renewal, meaning it was somebody who received funds in cycle 1 or 2, that it still addresses a need and gap in Adams County, but it did not necessarily specifically need to be tailored to those 4 areas I mentioned earlier. Is there some level of collaboration with other entities in Adams County and across this region? Does the organization demonstrate a successful track record and ability to access necessary resources, such as infrastructure or workforce, to complete the project? Is the project cost efficient and within the organizational purview? This can be based off things like experience from historical projects. And then the last criteria is the extent to which other funding sources could be utilized, that concept of braided funding. All applications were scored on a scale of 1 to 4, with 4 being that it exceeds expectations in meeting this criteria. 3 means that it meets expectations, 2 that someone meets the expectations, and 1 that it does not meet the expectations. Those, just for the nerdiness behind the scenes, those scores are then aggregated into a weighted average. So some of these criteria, the council, the previous council decided to apply some weights to, denoting them as just slightly more impactful in the scoring criteria than some of the others. And so based on that, they have a weighted average, and that is something that you will see when we pull the scores up. Before we dive into the official recommendations, questions from folks on the call, from the council.
Just add the editorial that this part, our divided effort, where we have some professionals who are in the arena doing the detailed scoring, as part of where we've received some of that credit across the state, rather than having elected officials and people who care deeply but may not have direct expertise trying to make all of those detailed decisions. Having a feeder group that gives us that information has been very helpful, and it certainly makes it easier for me to consume better than 500 pages of deep proposals that I lose focus on quickly.
Yes, they are some meaty proposals. So much good work is happening in this region, though. But they can be a lot to go through, which is why the council has opted to have this vetting committee to do some of that vetting and provide recommendations directly to the council, so that you all really have the opportunity to like sit with those recommendations, ask some clarifying questions, things like that, rather than, again, having to go through 500
I
pages
appreciate
of
that vetting committee
applications.
very, very much. The amount of work that they put into this and the amount of detail that they put into it is incredible. So
I will
appreciate it.
also say out loud, we did have a fifth vetting committee member who wasn't able to participate in this round, but has participated historically, and that is Heather McClure with Adams County Government. I would like also to provide the disclaimer that if generally these folks don't necessarily have an application in the ring, but if they do not have the opportunity to score their own application or necessarily provide a scoring recommendation related to their own application, just similar to how you saw Dr. Weidenbach recuse herself from voting around the health department budget amendment. The same thing operates here. With that, are we ready to dive into the recommendations?
Absolutely. And as we do, I'll encourage people, I realize that we have some time reserved for questions at the end, but there are enough of them that if you've got some questions on things, please feel free to jump in and ask those as we go through, and we'll do our best to keep up with that. It's much easier than trying to circle back and remember which one we were seeking detail on later.
Absolutely. And Ben, I'm going to stop sharing my screen and actually ask you to share yours with the spreadsheet. And while Ben is doing that, I will provide the overview of the recommendations that the vetting committee has landed on. As a reminder, Ben and I are not participants. We do facilitate the vetting committee sessions, but we are not necessarily like saying we're at RMP are not saying these are the recommendations. This is the recommendations from those vetting committee members that you just saw on the last slide. With that, applications were reviewed by the vetting committee, and their recommendation is to distribute approximately $5,894,353.19 to 20 applicants, plus an additional $982,532 to come from future disbursements. There are a couple of folks that wrote for multi-year funding, for funding over the course of 3 years, which I know the council has been super open to. Historically, although nobody really has written for multi-year funding, but there were a couple of applicants that did write for it. So it is recommended that some of those multi-year requests do move forward. We have the vetting committee has landed on a mix of full funding and partial funding, as well as some not funding recommendations across the 30 applicants, and we did see a mix of both new applicants and current grantees across all of those different categories. So the way this is going to work, and please jump in with questions. Ben, I would love if you could just start from the top, share just a little bit about each application and what they're applying for and what the recommendation is, and we can ask for any clarifying questions from folks then.
I think we're looking at these from the top ranked down. So when we hit the line that's sort of the end of the recommended funding, that's somewhat due to where we begin to run out of money that we should be kicking forward, and that's also where the recommendation or where the applications don't have the same strength as those that we are looking from the top. So definitely having the chance to focus first on those where there is probably less question, should we proceed with this or should we move forward with it? And more, is that dollar figure something that's consistent, and is the priority consistent? When we get into that mid area, will be more of, is this consistent with what we want to do? Do we expect that there's the right success, and do we have confidence in moving forward with this one?
Awesome. Thanks, Peter. So yeah, I've already gone through and pulled sort of my best attempt at a truncated, summarized overview of what each of these applications are for each of the ones as we go down the list. So I'll just give that snapshot as we go down, open up for questions, and then I want to try to leave as much time as possible for that discussion that I know is going to take place after we actually get through all of these. So Porchlight is proposing a project that would enhance access to evidence-based treatment for opioid use disorder to individuals who are unhoused, justice involved, and are experiencing other risk factors for opioid overdose. We will work in collaboration with Stout Street Foundation, The Crossing, and Adams County Intervention Community Correction Services to support 2 dedicated PLH clinic staff who will be stationed at each community partner site in a regular rotation to educate individuals about treatment options, arrange access to care, and deliver treatment services. Any questions specific to that application before we
Can
move on?
we also clarify at these stages the score that they received and the recommendation from the vetting committee? Because I think that will start to help prompt some questions.
Absolutely. Score received 3.81 repeating, and the recommendation is to fully fund the $129,273.03 requested. Vetting committee felt that Porchlight had a good track record and are embedding access into areas of need. Letter of support from a prospective site. They did find it odd, however, that they were not mentioned in the Stout Street Foundation application.
They mentioned Stout Street, but Stout Street did return the favor.
It would appear. It would appear so.
But also we recognize that those proposals are for different things as well. So that's perhaps why they may have not been included in that application.
And the notes can be really anything that just popped into the heads of the vetting committee members while they were reading over them. So. Shall I move on to the next
Go
one?
ahead and move on to Stout Street.
All right,
Again,
Stout-
I'm trying to keep an eye for hands up, but feel free to interrupt if you have a question. Sorry, the dog has come in.
Stout Street Foundation, our program includes medication-assisted treatment and mental health medication services, peer support systems, workforce and training targeted at individuals primarily from lower income backgrounds in Colorado's rural, urban, and metro regions. Additionally, our program serves as a critical alternative to incarceration, partnering with the jail to educate inmates on recovery opportunities. They are a previously funded grantee requesting $958,782. They scored highly as well, 3.77. And the recommendation of the vetting committee is to partially fund at $550,482, as they felt the connection between many of the infrastructure upgrades and providing MAT treatment was not super clear in the application. But they do recommend funding all items outside of the capital expenses.
Okay, yeah, I think that makes sense. I understand the need for the capital work, but that's been more difficult to fund out of.
Are there any questions, or shall I move on?
Both Stout Street is primarily functioning out of Denver. Do they have a lot of information on how they're serving Adams County?
So they are serving, I believe, from their first cycle of funding. Actually, I don't know if you remember the specifics on the breakdown of the numbers, but their location is Commerce City, correct? And I believe they are serving. Did they set aside a specific number of beds, Ashley, in cycle one?
I am looking at the key driver right now, but they do have a presence in Adams County. They have been serving Adams County community members, which is why they had been funded for receive cycle 2 funding. Let me pull up their key driver.
Can I speak to clarify some of that for you guys? Hello?
Oh, this
Yes,
is Robin
yes.
Winters,
Is my mic
who
on?
spoke up, who is with Stout Street Foundation.
Okay, yes, Robin.
Hi, thank you for the opportunity. Yes, we absolutely serve Adams County. We are in Adams County. We reside in Commerce City, Denver area, just in the Northfield shopping area kind of area. We are the number one alternatives to jail in Adams County. For 70% of our population comes from incarcerated individuals. So we've been serving Adams County for a very long time, and it is a primary source for opioid abatement
Okay.
in the county for
I
long-term
expected so. I
treatment.
just wanted to make sure. I just hadn't seen that before. Okay.
Yeah,
Thank
and
you.
I will say
Absolutely. We are a number one source in the Adams County and serving.
in their data, they are directly also tracking data about individuals from Adams County who are participating in the program. Not only just who's participating, but also how many are completing, successfully graduating from the program, how many are gainfully employed, and how many program participants are earning those skills credentials as part of some of the additional wraparound services that they are providing to folks.
Perfect. Thank you. Other comments, questions on Scout's page? Okay, Ben, go ahead.
Perfect. All right, Denver Recovery Group requesting 497, 124, 76. This funding would be to hire 3 licensed counselors or peer support specialists, 3 nurses, 3 front desk personnel, a part-time nurse practitioner or physician's assistant, and an overnight security officer to support expanded operations at their North Glen methadone clinic, such that they can operate 24 hours Monday through Friday and 8 hours on weekends, with telehealth initiation available 24/7. The vetting committee rated this one at 3.718 repeating, and they recommend fully funding at the 497,124.76. And then you can see the rationale here. Vetting committee believes their expansion for the methadone and their work in the justice system makes this a strong proposal addressing key gaps.
Perfect.
Any questions, or shall we continue on?
Go ahead and go on unless somebody interrupts.
Okay. Next one is Red Point. Amount requested is $467,335. And this request is to establish a new intensive outpatient program location for adolescents and adults in Westminster that will provide evidence-based addiction treatment, peer support, and practical life skills tailored to each individual. And the vetting committee rated that one at 3.718 repeating, and recommend fully funding as well at the, sorry, I'm just looking at these and realizing I was having deja vu there because the numbers are almost the exact same as the previous one. $467,335. And vetting committee is in support of fully funding this proposal, although a question was lifted about the plan for sustainability past the initial 10-month lease. And we are still working on getting an answer, a statement to that effect.
Is it helpful to talk about that now, or is there another way you'd like us to submit answers to those questions?
I think it's fine if you would
It
like
certainly doesn't hurt. I'm happy to hear an answer to that now, and then of course have it supplemented in writing.
Okay, excellent. Yeah, so I'm the program director for Red Point. I'm Alex Moore, just so you know who I am, and I was part of the submission of this proposal. So do you have any specifics about the questions that were had about the sustainability, just so I can kind of target answers?
I think the concern in general, I don't necessarily have specifics. This is what the note that the vetting committee left.
I'm happy to share
but
that context, Ben. I think the question, it wasn't a huge concern to the vetting committee, but they were just curious about what sustainability looks like. One of the budget items is around a 10-month lease. And so they were curious about the sustainability of the lease beyond that 10 months.
Oh, gotcha. Okay.
That's it.
Okay, totally makes sense. So yeah, I mean, we have several locations where we're absolutely, it's more for starting the new organization than for, or the new branch of our treatment centers versus needing it to be paid by someone else long term, right? We have several locations already that are fully self-sustaining. It would just support us to be able to, with the startup cost of opening a new branch. So does that answer your question, or do you think other contexts would be helpful?
From my perspective, that addresses well enough to keep going. This was obviously a high scoring. It wasn't something that caused tremendous concern and backing off of funding. Unless anybody else has additional questions for that. What I would point out is that this is the first first application addressing what we consider to be the highest priority, most missing service in Adams County. So I'm very appreciative of the application and appreciative of the score that it obtained. So that took some work to get that kind of score from this team. So
Awesome. Thank you so much.
okay, Ben.
Awesome. Okay, moving on to Servicios de la Raza. They requested $760,000. And high level, their application is to fund culturally and linguistically tailored trauma-informed peer services, coupled with workforce development support to low-income community members who are current opioid users or at risk for opioid use, with a particular focus on Latinos and other communities of color. Their application graded out at 3.65909, and the recommendation of the vetting committee is to fully fund as well. There's a good chunk of rationale here, but the vetting committee felt that their application was very, very impressive, and offers a culturally responsive, comprehensive approach to addressing the disproportionate impact of opioid addiction on Latino communities in Adams County, supported by evidence-based practices, and is culturally tailored. And the organization has a great track record, demonstrates exceptional capacity through their 52-year history.
I think that's an important point as well in this area that we have underserved community with a significant percentage of the population.
Any questions on this one? Awesome. Okay, moving on, City of Thornton. This one is a renewal application. This grant would fund the addition of 3 co-responders to the existing program. They are also working on establishing direct connections with hospitals so that individuals can be placed directly into care after they respond to calls. This grant is for $600,000. The request is for $600,000. Grant scored at 3.318, and the recommendation once again is to fully fund. The vetting committee feels that adding 3 additional co-responders will further expand the impact of this effort.
This is probably one of our fastest benefiting programs out of the first years. Adding that co-responder program at the very beginning of relationship to people while they're at risk, while they're perhaps not performing at their best. This is one of the programs that I think is an example program being followed as a pilot by other cities. So City of Thornton really has been at the forefront on this one. I appreciate it.
Any other thoughts before moving on? Awesome. Okay, next grantee, Westminster Public Schools. This is a new applicant. The amount requested is $887,576. I will call attention to the fact that in their application, they requested this funding for over a 3-year time span and specifically called out, I believe, an amount to be funded in year 1, which was $298,093. So with that said, the full impact of that funding allocation would not necessarily be felt immediately in this year and could be distributed over a few years of funding. The description of their activities: WPS will launch behavioral health pathways and partner with community colleges to offer concurrent enrollment in behavioral health care to build a future behavioral health workforce. In addition, they will expand professional development for existing staff to better understand the opioid crisis and how to help at-risk students, as well as expanding early interventions and school-based healthcare programming. That application scored at a 3.1818 repeating, and the recommendation once again is to fully fund. And I think I can sort of sum up that the only consideration, one of the considerations from the vetting committee was essentially just the delayed impact of the funding with funding workforce programming, but they ultimately still felt that it served a good function, and that it's something that, you know, it was one of our gaps that needed to be invested in.
And I see we have a hand from our commissioners.
Yes. Hi. Quick question on that. So the recommendation is to only fund, if you scroll over to the left just a little bit, to only fund the 298. So are we approving the 298 today, or are we approving the 589?
We're approving the 298 and then would do a second vote later for an extension for the next year that would be dependent on the program meeting expectations being managed as we need to, following evidence-based practice. So our extensions or continuations really are dependent on meeting the proposal's expectations.
Okay,
That's
that's
great.
helpful. Thank you.
But that's part of why we don't want to award 7.5 million today, because then we don't have the remainder of the money available to extend later.
Okay, that makes sense. Thank you.
Any questions on this one before moving on?
Definitely, this fits one of our additional challenges when we talk about the need for peer support and recovery. There aren't enough qualified people in the county to provide all of the services that we need. So providing the mechanism to become qualified expands our capabilities to serve people further into the future. So I think this is an important focus and area. That's why that was one of those 4 top priorities. And this is the first application we've seen to that end.
Anything else from anyone? Awesome. Okay. Moving on, the next one is Stater Opioid Consultants. This is a new applicant, and the amount requested is $587,084.30. Colorado Connects is a novel collaboration between St. Anthony's North, HCA Health 1, Mountain Ridge, Thornton Fire, the Naloxone Project, and Stater Opioid Consultants. Together, we will seek to dramatically increase treatment infrastructure and innovation in emergency settings, launch a new substance use disorder treatment navigation program for patients, and coordinate the efforts of leading healthcare systems in Adams County. They will do this by providing trainings to hospitals around MOUD, deploying a team of substance use navigators, establishing a dedicated addiction consult line, and form a leadership council composed of content experts. The score on this one is 3.1818 repeating, and the council's recommendation was, I think, a difficult one, but not to fund this one, lifting the following points. The effort may be duplicative of other efforts already underway. They felt the budget did not match the activities. The timeline may be overly ambitious. That was lifted by a couple of the vetting committee members. They committed to support things like naloxone distribution, but these items were not included in the budget. And then the community need for some of the outlined activities was not sufficiently demonstrated in the grant, and it's not clear their outcomes beyond education and EMS naloxone. So this is one, obviously the first one, where the recommendation of the committee was not to fund. If there are other questions, I think we'd be happy to dig into any other materials.
For informational purpose, again, for the council, generally speaking, our no's have meant not now or make these changes, look at this approach, come back, here's how to strengthen your application. So rarely have we said the door is closed, but we have looked at those where programs either don't meet the expectation in terms of evidence-based practice or best practice, or those that don't feel as secure an investment at this time. So our committee struggles, certainly the recommendation committee struggles to say no. So generally speaking, they provide this kind of feedback for, we can come back with a stronger application in this sense. Any additional questions on this one or comments on this one? Since it's the first one with a recommendation not to fund.
Okay. Moving on to Sober AF Entertainment. This is a new applicant as well, requesting $72,781.40. What they will be doing is peer recovery workforce development initiative in Adams County, focused on growing the local pool of trained peer support professionals, hosting community-led sober events, and improving harm reduction awareness. By partnering with local universities, treatment providers, and recovery groups, we will train and certify 30 Adams County residents as peer support specialists, hire a local student intern, and host 8 sober-friendly community events where newly trained peers can practice their skills and complete required service hours. The council scored this one out at a 3.09, just about a 3.1. Recommends fully funding that $72,781.40, and the vetting committee is recommending fully funding this proposal with the confirmation that events are being held directly in Adams County, and we did get a response on that. That all events will be held in Adams County, and they are happy to partner with Adams County community colleges as well to host events. Are there any questions on this application?
I'll just clarify, when Ben is saying council, he means vetting committee. You all are the council.
I just say them completely at random, it seems. So yes, thank you, Ashley.
Questions, comments? I do like the fact that most of the recovery programs are peer-led and lived experience led. And I think that's a helpful element to this.
Shall I continue on?
Sure.
Okay. Colorado Coalition for the Homeless. The amount requested, this is a new applicant as well. The amount requested is $203,274. This proposed Renewal Village peer support service will integrate peer-led recovery support into, peer-led recovery support into the housing program, reduce barriers to treatment, and increase long-term recovery success. CCH will hire and train 2 1 FTE peer recovery specialists with lived experience of addiction and recovery to provide one-on-one support, group-based recovery services, and harm reduction education. This one scored out at the same as above, 3.09, and the recommendation of the council is to fully fund that $203,274. But they had a question on how many Adams County residents will be served directly. They see a strong partnership with an existing recovery community, and especially focused on serving underserved community members. We are still working on getting exact numbers for how many they can expect to serve. Julie, I see you have a question.
Yeah, and I think that would be something that I'm really interested in before I would approve this, is how many, like, what is the impact specifically to Adams County? And like in what areas? One of the things that I do like about some of these proposals is that it's kind of, I love the geographic distribution of all of this. So not only how many Adams County residents will be served, but also in which geographic areas, because I would like to see that every bit of our county gets some of these funds.
We have had some efforts, and in some of our previous voting cycles, we're able to recruit and find dollars to spend farther east in the rural areas of the county. So there has been some rural outreach very specifically built into this.
Okay.
And mobility has been the biggest answer to that.
Okay.
Yeah, and
Cool.
I
Thank
can
you.
at least clarify what they've shared so far in their application. Those peer support services would be added to Renewal Village, which is located in the Globeville neighborhood of Denver, but pretty close to the Adams County border, but not directly located in Adams County. What they expressed in there, and this is where the clarification question came up, is while they did clarify that it would be used for Adams County community members, that was why the question came up of how many, because they did not specify that in their application or in their Q driver, which was a required attachment.
And I will just take this opportunity, Ashley, I don't know if you want to expound upon this at all, but to mention that what we do here today in terms of sort of ratifying a decision on what to fund does not necessarily have to be the exact final say. We can pick some things to fund, and then where we do have follow-up questions or contingencies about funding, we can conduct some additional follow-up, and then we have sort of a system we're developing where we can get that final vote on those particular extraneous applications that we don't come to a final decision on today by way of email sometime next week. So we will be sending out some follow-up as well.
And it's an electronic consent process that we use with our board of directors. So it is legally sound. It meets the needs of the Sunshine Law. So I just wanted to say that out loud.
So let's earmark that one as requiring some clarification before it would get a final approval.
I'm just going to highlight real quick. All right.
And make Ben really do complicated color coding that then we have to remember what it means later.
Okie dokie. Moving on to 27J schools. This one is a renewal application for $255,512. This grant would help the district focus on the things they have found to be successful while phasing out approaches that haven't worked yet. This grant allowed us to implement a substance use intervention program where 13% of the student population at our alternative campus is actively participating. Among those students, 10% have reported complete cessation of substance use and are now working with a mental health interventionist to build skills for sustained sobriety. Additionally, 26% of participating students have reported a reduction in their substance use since beginning the program. This grant would expand these activities and continue to fund a wraparound coordinator who has connected and partnered with over 40 community organizations, built a community resource list, provided district-wide trainings for mental health staff regarding available community resources, updated the school district website, increasing accessibility to resources for families, and engaged with more than 30 families directly to support care coordination for substance use intervention for their students. That is a lot of things that the wraparound coordinator did. Sorry, that list kept going. Let's see, their score was a 3 flat. Nice to see a full round number there. The recommendation is to fully fund that $255,512. And the vetting committee rationale: 27J schools demonstrates clear impact with their substance abuse prevention program, showing measurable outcomes that align with opioid dashboard goals. The program effectively implements evidence-based models like screening, brief intervention, referral to treatment, while addressing school-based prevention and intervention needs with a valuable new partnership with Adams County Health Department, enhancing their approach. As an established school district, they have the necessary infrastructure and track record to continue successful implementation, though they still require continued funding until they can supplement with general funds. With their demonstrated results, clear implementation strategy, and strong community partnerships, full funding is warranted to maintain momentum.
And this is one of those areas, Julie, that 27J does reach clear out into the eastern region and surrounds the airport.
Any questions, comments on this one before we move on?
And that's, I guess that's half of the effort towards prevention. So we didn't lose focus on prevention, but keep that in the schools in particular.
Awesome. Okay. Moving on to culinary, hospitality, outreach, and wellness, or CHOW for short. I like that name. Let's see. The amount requested is $500.
They may win for the best acronym.
Yes, I think so. Amount requested is $577,518. Again, I will point out that this is another applicant that requested funding for over a 3-year time span. So not all of that impact will be felt immediately on the funding pool. They are providing community-based naloxone and fentanyl testing, strip distribution, and overdose prevention training to individuals in the hospitality industry in particular. They also have a nice round score of 3, and the recommendation is to fully fund them at that $184,470 for the first year. And the vetting committee, and then moving forward, $393,048 over that 3-year span. The vetting committee is recommending fully funding this proposal over 3 years. Only the first year would come from this round, and the others, sort of what I already talked about. The specific focus on the hospitality industry, where opioid misuse is prevalent, and a focus on those disproportionately impacted by the crisis, made this proposal stand out. The vetting committee did have one follow-up question: to what extent will these dollars be used for hospitality employees in Adams County directly? And the answer to that question was that the intention is 100%. That 100% of those funds are used for hospitality employees in Adams County.
I'll also clarify that this wasn't in the description, but some of the other things that they are doing as well are peer support meetings and individual peer support directly for employees in the hospitality industry who are experiencing these challenges, as well as strengthening partnerships with social workers, peer organizations, and clinical providers to create a seamless continuum of care.
And until I read this application, I had no idea how disproportionately impacted that particular set of workers was. Julie, I see your hand up.
Yeah, that's actually kind of my question, is like the disproportionately impact on this particular group. And then, like, did they give any extra feedback on how do they find, or like, how do they find these particular hospitality workers? Like, how do they build that kind of group, and how do they do their outreach? I mean, it's such of a specific focus of people. I just want to make sure that they're really still able to be effective in providing this service to a good number of people to benefit from.
Yeah, that's a great question. From what the vetting committee was able to understand from their application, they use an ambassador model, a volunteer ambassador model, where they have folks from the industry who are out in the community and connecting directly with these individuals to recruit them into accessing these supports.
Okay, so then part of their outcomes measured, right, would be how well is this ambassador model working for them, and how successful are they able to do this work, right?
Correct.
It sounds interesting. Okay. All right.
Yeah, and the other thing to note about their ambassador program is that it is people who are actively in recovery who are serving as these ambassadors. So they're also looking at the impact directly on the ambassadors themselves in their recovery journey. So some of the metrics that they identified that they're going to be measuring is that impact on ambassadors in the peer support model, actual direct impact on folks in their recovery journey. They're going to be looking at the number of referrals, because the continuum care piece, and then of course with their actual distribution of Narcan and fentanyl testing strips, they're looking at, of course, that too.
Okay. Hey, I learned something new today. I like the idea. So cool. All right. That helps.
Actually, I do have one question. When it says, so their name it says culinary hospitality. Is that the only area of the hospitality industry they're focusing on?
My understanding that it was mostly a service for the restaurant industry, but maybe that's incorrect. Actually, I know you're looking at the larger application.
Yeah, their application appears to be more broad in categorizing hospitality workers more generally, but I do believe that has been their historical focus. But that is a question we can get an answer to as well. But they really just kind of group it as hospitality professionals as a group.
But hotel hospitality didn't make the acronym work.
Right, exactly. Totally. And I absolutely, in the hospitality industry, that's the first place you should go, is the server. Yeah, I mean, that's I would go to the culinary arm of that as well. I just think it's great if they're having ambassadors out in this community talking to somebody who's in the culinary side of the building, or the hospitality resort or whatever it is, that you know, it could also be extended to somebody who has a need, who's technically in a different department. You know, I didn't know how rigid they were going to be.
Yeah. And it looks like, just based on, I'm reading from their application right now, the first piece of that like initial outreach piece will be at bars and restaurants in Adams County. But that it references that the efforts will support the food, beverage, and hospitality industry more broadly. They write, the food, beverage, and hospitality industry operates in tight-knit, often isolated spaces, with each workplace shaped by its own culture and leadership. And that is part of some of the rationale for their ambassador model as well.
I will note the
Thank you so
comment
much.
that we have on the side that Sober AF it has an acronym of SAFE, and that's also also very cool. Just hadn't caught us as much as Chow did.
With all,
I think I would make a note as well here on the Chow application for Rocky Mountain Partnership. This is probably one where evaluation assistance and metrics assistance would be of use. I think that it's a great purpose, a great intent. They may need some assistance from you in figuring out how to present the result of that.
So with all of that, is this an applicant? I know there's some robust discussion around it and some questions that we all had, some of which were answered. Is this an applicant that you would like us to conduct direct follow-up with? Or is this one that we feel comfortable making a decision now on?
I'm comfortable with the decision now and haven't seen any objection to that. I think we just want to make sure that we're indicating in the contract for it the requirement to work with you on how to measure and produce outcomes in line with best practice and evidentiary based results.
I love that. We will make sure that's
I
included.
get that.
And also in all of our contracts, grantees are required to work with us on programmatic data reporting, including submitting quarterly data to Rocky Mountain Partnership Cradle to Career that is then visualized through the Adams County Opioid Abatement Data Hub and made available to you all, which we'll get a chance to dig super deeply into next time. And that's the requirement they have to us just from a reporting standpoint. And they are required to have a key driver document on file, which is kind of like a logic model. It just starts with the big picture and then gets more narrow, which is a tool that Rocky Mountain Partnership uses extensively. And that was actually one of the requirements for the application, was that they needed to submit a key driver document.
Ben, in the interest of time as we're working through, I'm going to have you not go into as much detail on those that the council recommended not funding, unless somebody wants to contemplate reconsidering that and bring it on the table to reconsider that decision. But even that I'm going to put back in the favor of having this council put it back in the hands of our committee to go ask additional questions that might change the recommendation. But I don't want to reconsider those at this point.
Noted. Appreciate
So
that.
if anything that is marked do not fund is something that you want to have additional questions come back, members of the council, then go ahead and indicate that and we'll send staff back.
Okay. All right. Well, I will try to sort of move over some of those ones pretty quickly here. So Hazelbrook Community Center was another one that was that requested funding for $147,000. This was one though that the vetting committee recommended not funding, and for the most part, that rationale was around some reputational issues around mismanagement of funds. They also currently do not operate in Adams County, and I don't think and some other things around what specifically they're asking for funding for, and a lack of clarity around their sustainability plan. With all that said, I don't think we had any follow-up questions for them, so we can move on.
We put that ball back in their
is
court
okay
if they
with
want
everybody
to
else.
submit another application in the future.
Yep. Okay. Moving on to a fully fund recommendation is University of Colorado at Denver. The amount requested is $250,000. This will continue to fund this is also a renewal, so we funded them in the past. This will continue to fund the MOUD provider while expanding the program and including a methadone option. They recommend fully funding this one, scored out at 2.909. And the vetting committee is recommending continued funding as this program has demonstrated success. It's also not a huge ask in comparison to the other applicants. Any questions, thoughts, concerns?
Okay. Keep going.
Okay, perfect. This is one I will stop on briefly because it is one that I think we are going to try to continue to, engage with the grantee and some capability building and supports around the data component. So as of right now, the recommendation from the council on this, or sorry, the vetting committee on this one is to not fund. This is Young People in Recovery. They are a renewal application. The amount requested is $171,147. And they are providing Adams County community members under age 30 to peer supports and offering 100 digital seats to our exclusive life skills curriculum program. The vetting committee likes this programming. The primary issue was that we have now funded them for the first 2 cycles. And there is just a lack of meaningful outcome data. We have, they, not that they haven't been submitting data, they have submitted data to us. They have submitted number of participants, some metrics around engagement, responsiveness, things like that. But one thing we had originally, they had committed to us to tracking was certain metrics like recovery capital index, for example, that actually speak to those outcomes and the impact that it's having on individuals that are in their programming. And as of right now, there's still a lack of data in that regard. So this is one where we'll reach back out after the fact.
I would love to continue working with them. I would love to continue seeing some mentoring for them on how to strengthen the program that they're offering and strengthen the data associated with that. But it's one where I at least for the moment, concur with the vetting committee that putting more money into this without strengthening the program first would not be as prudent.
Awesome. Okay, continuing to move on. Community Uplift Partnership. This is also a renewal, and they have requested $200,000. This grant would continue to fund prevention programming at their 4 coffee houses around Adams County. To date, they had a 93% graduation rate in both classes in the fall. Of the students completing the program in the fall, 100% of students reported being more educated about preventing opioid use and about other resources in the community to help friends and family. And spring classes are already full.
And this is our second of 2 that are focused on prevention and education, which of course is a good return on investment. It's the least expensive thing to prevent opioid misuse in the first place.
Correct. Yep. The vetting committee recommends fully funding at that $200,000 mark. They demonstrate impressive impact, 93% graduation rate, 100% of students reporting increased knowledge, partnership with Lester Arnold High School, which now awards academic credit for program completion, significantly enhances the program's reach and effectiveness for at-risk youth. Organizational track record is still developing, and additional funding sources are still being cultivated. But they've proven their ability to implement the program effectively and adapt it to meet educational goals. Any thoughts on this one before moving on?
Good place in the continuum.
Okay. All right. The next one is Cross Purpose. This is a new applicant. The amount they're requesting is $379,830. Cross Purpose will enhance peer support, provide workforce development opportunities, and collaborate with key community partners, such as the Empowerment Program and Greyhound Park Apartments, to offer comprehensive wraparound services to residents. This initiative will include enhancements to peer support programming, culturally competent mental health classes, workforce development that addresses personal and professional barriers through skills training, mentorship, and holistic support, and expanding resources including housing, employment, and recovery services with added support like childcare at recovery meetings. This one graded out at 2.7727. And the recommendation of the council is to partially fund this one. I will just remind you, the original ask is $379,830, and the council is recommending, or sorry, the vetting committee, I cannot get those straight, is recommending funding this one at $279,830. And the reason for that is there is one component of their programming called the Empowerment Program, which does not, we actually asked this follow-up question to them already, would not funding the Empowerment Program significantly impact the other programming that is already a part of your application, like the peer support programming. The Empowerment Program is primarily, and Ashley, I don't know if you have it pulled up on your end so you can speak exactly to what it is, but it's around some housing supports, and there's, I think, a significant amount in there that's a mortgage payment, I believe.
So it wasn't necessarily the program itself, and this is actually not the one with the mortgage payment. We are getting there. But the rationale for not funding the empowerment program was that it is a sub-award to the empowerment program, and it is unclear in the budget what those dollars are going towards, which there wasn't too much clarification in the follow-up around that. That was the rationale of the vetting committee. It's not just deciding not to fund part of the program. It was a sub-award that it wasn't clear what the empowerment
and
program.
we're not designed, right? We're not designed to be the handoff in a baton pass to another award. So if the empowerment program is a separate entity, they should be applying for this funding directly and not through a sub-award on the cross-purpose application.
Yep. So that was the only thing for the vetting committee. Otherwise, they were like fully fund the rest of the budget except for that sub-award.
Okay. Okay. And
moving on, University of Colorado School of Medicine is our next applicant. This is also a renewal. Amount requested is $52,670. This program has two components: inpatient and outpatient service. The inpatient service, psychiatry resource for integrated substance use disorder and mental health care. PRISM will provide evidence-driven management of acute withdrawal by providers with expertise in addiction medicine. In addition, the service will include a social worker and a case coordinator to support the post-discharge social and logistical needs of the patient. These two services, as you can see, are sort of connected. So that leads to the outpatient consultation clinic. PRISM will also provide evidence-based assessment and brief treatment of substance use disorder and co-occurring mental health issues in the outpatient setting. The outpatient consultation clinic will enable post-discharge medical care for patients seen by the inpatient PRISM team, provision of ongoing medication management of substance use disorder and co-occurring mental health disorders, addiction counseling, and coordination of medical needs. The outpatient consultation clinic will help bridge patients in need of longer-term support to community-based treatment services.
So actually, this is not the correct description for this grant. This is a renewal from Colorado, University of Colorado School of Medicine. There is another applicant, University of Colorado School of Medicine, Department of Psychiatry, which is what that description is for. This is actually extending an existing grant where they have formed a partnership with the Colorado Department of Public Health to distribute fentanyl and xylazine test strips, as well as syringes at no cost to them. They've also been expanding distribution of naloxone as well. So it's a small grant ask of $52,670 to continue connection to recovery care, as well as harm reduction program strategies and naloxone distribution. So it's essentially continuing to fund, knowing that the need has grown. And so
I was wondering how we were doing all of that for $50,000.
Yep. And I will update that in here.
Okay.
Apologies.
You're good. There are so many that have very similar names. The only big change from the previous award, which was all of the distribution of fentanyl, xylazine test strips, and naloxone, is that they've actually identified a growing need for distribution of naloxone. They've been using substantially more naloxone than they initially anticipated. They've been trying to minimize the use of grant-funded naloxone by using patients' insurance to pay for naloxone wherever possible, and this includes for the large population of their patient population that has Medicaid. However, in partnership with our hospital pharmacy, they found that the pool of patients who need naloxone is larger than they realized. not all of them are seen by their addiction medicine consult service, which has led them to underestimate the need for this medication. And they've been dispensing up to 100 units per month to patients discharging from the hospital who otherwise would be unable to afford naloxone.
Actually, thank you for catching that. I do not know how I missed that. My apologies.
No worries. Okay, let's keep going. I think we've got 3 more with recommendations to fund.
Okay. Next is All the Way Well. They have requested 300,000. They are also a new applicant. They are trying to stand up a collaborative effort with Elevate Recovery Homes, Sober Living in Adams County, the nonprofit All the Way Well, and True North Recovery Services to provide a 90-day program providing employment readiness, recovery skills, nutrition and fitness, mental health support, and financial literacy curriculum, peer and intensive outpatient support to men in recovery. This one scored a 2.
That intensive outpatient support is, again, one of our biggest gaps.
Yep. And this one scored a 2.7045, and the recommendation is to fully fund. All the Way Well's Trailhead program addresses a critical community need through its comprehensive 90-day curriculum, supporting men in recovery with impressive outcomes, 90% graduation rate, 81% employment. Proposal lacks some detail that result in lower scores. This likely reflects grant writing experience rather than program quality or potential impact. The collaborative structure.
And that's another opportunity, Ben and Ashley, for making sure that their reporting capabilities perhaps exceed what their original grant writing capability was.
Yes.
I am now today worried a little bit about their sustainable funding being Medicaid based, but that's another conversation for another day.
Yeah, yes.
Yes. Any other thoughts on this one before moving on? Okay. Next, we have Promotores de Esperanza. This is a new applicant requesting $250,000. The expansion that they would be funding will include one-on-one peer recovery support and/or peer group recovery support and holistic wraparound recovery care services, including recovery care education, including overdose reversal training, Narcan distribution, and safe substance use practices to actively consuming individuals. Promotores will also provide workforce development, including resume building, professional development, interviewing skills, and targeted services like AccuDetox. So this was one.
And I'm just going to hop in here super quickly. Their main 3 strategies, and this summary I think does a good job of explaining it, but their main 3 strategies are that peer recovery support and awareness education, the AccuDetox, and workplace safety, which Ben will get into some of the rationale of why there's a recommendation for a partially fund on here.
Exactly. So I will remind you before we go over, the amount requested is $250,000. This one scored 2.68, and the recommendation is to partially fund at $103,400. So as Ashley mentioned, there's sort of those 3 components. There's the peer support component, and in essence, there's a lot of stuff here, but there was actually some robust conversation within the vetting committee around sort of the efficacy of AccuDetox as a standalone intervention, which it looks like it would be here because it wouldn't be done in conjunction with MOUD. So just know that there was not a unanimous consensus around how efficacious that would be. And then the workforce safety programming component and workforce component in general is not necessarily directly aligned with opioid outcomes. It's a much sort of broader in scope workforce approach. And so with all of that said, the vetting committee recommends funding the peer support component because they believe that Promotores does good work in that regard, and that aspect of the programming was well fleshed out. But those other 2 components, namely AccuDetox and the workforce component, were not necessarily aligned and had some robust discussion around them.
And this is where we actually want, that is the recommendation that the vetting committee has put forward. However, wanted to give you some additional options in case that there was interest in funding that AccuDetox. If you were to fund just the peer support line items, that would be the $103,400 and would include peer recovery coaches, overdose awareness education, Narcan distribution, and participant incentives for peer recovery participants, as well as that small administrative fee. The second option could be if you wanted to include the AccuDetox in there, it would be $123,332 to include that plus AccuDetox providers and AccuDetox supplies. And then the third option could be that you could say we would not fund them. But those were there was not a huge consensus on a couple of the items, specifically the AccuDetox piece. So wanted to make sure you had that full context.
So this is where I would look for feedback from specifically Kelly and Julie, whether to move forward with something on peer support or send this one back for revamping and resubmission with things that are more consistent with best practice.
Yeah, I would recommend resubmission for this one and asking for clarification around some of the questions that we had and see if they want to take another stab at strengthening it.
I'm comfortable with that, Julie and Kathy.
I'm
I see you
comfortable with
nodding.
that too. Yeah, I'm comfortable with that too.
Okay.
This one is not to fund as of
Right. So let's keep moving to Anschutz.
Ashley, can you make note of that as I move on here?
Absolutely. I think the next one's Reaching Hope.
Yep. All right. Reaching Hope.
I'm skipping Reaching Hope since the recommendation was not to fund and we're down to about 15 minutes, unless
Great.
somebody wants to reconsider it.
And I can just very, very quickly, the reason for that is just how well aligned the work is directly to opioid outcomes and not around the quality of the application. That was
Right.
the thing.
They have great programming. It just, the vetting committee didn't see as much of a clear connection to opioid abatement.
Moving on to University of Colorado Anschutz. This is a renewal application for $362,476. Our program has been successful in developing collaborations with the Colorado Department of Corrections and with Wellness Opportunity Resiliency through Health, which refers patients released from jail. As such, we would like to expand this programming by increasing the amount of time our peer recovery coach is able to dedicate to our clinic from 0.1 FTE to 0.3 FTE. We would like to train our therapists in eye movement desensitization reprocessing therapy to provide this as an option for patients with trauma. In addition, navigating this partnership requires significant administrative time, and as such, we would like our director of operations to be able to commit 0.1 FTE of her time to this project as well. This one scored a 2.636363 fully fund for that 362,476. And the vetting committee was originally planning to move forward with a recommendation for partial funding. However, after revisiting the original application materials, feel comfortable funding this effort in full. The one thing they lifted was that they
Do you have
mentioned
any idea on how much of the funds they have left, not yet exhausted?
you know what? That is a great question.
I'm here. I can answer that for you.
Okay.
I'm Christine Eve. I'm the PI in this project. I don't have the exact numbers, but it's like a few months of funding, and the reason is because it just took a few months into the project to hire our therapist and our patient navigator. So
I was just trying to figure out if we had still had half of it in a bucket or and hadn't touched it yet.
I think it's enough
if
for like
we're
a
just
couple
a few
months.
It may take us a few months to get through our process anyway. So I'm comfortable moving forward with the recommendation. Then I was contemplating a delayed contract in order to ensure that the funds were exhausted first. But if we're down to a few months, that's not really an issue.
Also, have any other thoughts before we move on to Kids First? Perfect. All right, Kids First Healthcare. Also a renewal application. I will call attention again to the fact that this is one that is being requested over 3 years, so $750,000, but the first year funding impact would only be $237,903. Grant dollars will be used for delivery of behavioral health services by a team of professionals listed below and help cover the financial gap between earned revenue and actual costs of care. Pre-licensed behavioral health providers at our community and school-based clinics who deliver direct patient care to support their behavioral health, a senior level licensed clinical therapist to deliver direct patient services and oversee pre-licensed staff and interns, and a behavioral health program manager to deliver direct patient services, establish and implement program policies and procedures, and maximize billing and coding practices, and supervise all team members. This one is one that they recommended partially funding. So this was one similar to the others. The vetting committee is recommending funding 1 year and making future funding contingent on illustrating outcomes. This organization received funding in cycle 2, and while we know it takes more than 1 year often to show an outcome, we do believe this will help ensure that outcomes are achieved.
General outcomes from Kids First have been pretty successful, so I'm optimistic for them. I think there's good potential there.
Perfect.
Okay, keep going. Department of Psychiatry, you read through that one. I think that's just a bigger investment than we're comfortable being able to make at this point in time.
Yeah, and the rationale was also, it appeared that in the request, it would be serving 2 to 4 adolescents per month at a price tag of over $1 million, and so $1.3 million. So
Right.
they just thought there were stronger applications and better use of funds in this funding cycle.
And I think what we can do here, since as Peter, you pointed out, we're running low on time, with the do not funds in particular, we'll send, you can, anything that you guys, you're welcome to dive into any that we didn't dive into enough here, and then send thoughts after the fact if there's anything that jumps out at you that you would like to revisit. But for now, I will just move past the do not funds.
I think when we're on our last one for consideration to fund in this cycle.
Yep, that's right. And right here is the line. So Colorado Nonprofit Development Center, Recovery Friendly Leader. This is a new applicant requesting $181,282. And this funding would be to expand existing workplace leadership education and training program, a tailored initiative designed to strengthen leaders' ability to identify, address, and support employees facing opioid or other substance use challenges, focused primarily on industries most impacted by the opioid crisis, such as warehousing, construction, and healthcare social assistance, but can be adapted to any workplace in Adams County. This one scored a 2.3636. The recommendation is to partially fund at $89,729. Again, a reminder, the original amount requested was $181,282. And the vetting committee rationale is recommends funding 1 year and making, is this the same thing? Oh yeah, recommends funding 1 year and making future funding contingent on illustrating outcomes. Concerns were lifted by the vetting committee members about the true capacity of this organization to achieve what it intends to based on the limited staffing within the organization. The vetting committee also felt the budget lacks a little bit of detail.
So looking at the recommendations for funding and the one that we pulled out for some clarification before finalizing it, that puts about $900,000 in MAT treatments, so about 17% of our investment. It puts treatment overall at just over $1 million, or about 18% of our intended spend for this year. Youth and outpatient outreach specifically about $467,000, or about 8%. Peer-driven programs at about $2.3 million, or about 35% of our total. $600,000 or 10% towards justice-based programs, $970,000 specifically in workforce development, and then $455,000, about 7% in prevention and education, which seems to hit our target numbers pretty effectively for where did we want to make the most significant investments. But I just wanted to provide a little bit of summary of did these come out relatively organically at the place that we wanted them to be. And my sense from those numbers is that it does put our most significant investment in the areas that we highlighted as being the most at risk and the most unfilled.
Okay.
Questions?
I appreciate that
comments?
overview. That's great, Peter. Thank you. I appreciate that overview that you just gave.
Thank you. We'll
I
see if
do
my
have one
math was
question.
accurate. Yes,
I do have one quick question. Looking at CrossFit, or if there are other religious nonprofits that who apply, do we have any, are there any protocols about whether any sort of religious or theological, any sort of religious
as long as
activities
the
are
pro-
incorporated in that?
Right, as long as the program is using best practice, industry best practice, evidence-based practice, and things that are consistent with the overall driver, there's no exclusion against having a religious-based program. When we had an applicant in the past that was religious-based but was using non-recommended best practices, we made the determination not to fund that one. But
Okay.
the way they approach this one, they're following best practice and don't exclude participation.
Okay, thanks. Or do they require any that you participate in any sort of class that, is religious education type of thing as part of their programming?
I do not believe that this is cross-purpose, so I do not believe that that's a
Cross-purpose.
requirement
I
of
think
their
they say
programming.
CrossFit. That's totally the wrong thing.
But that would be
Cross-purpose,
but that would be a great qualifying question. Let's just ensure that there's not a requirement for participation that would be inconsistent with overall county and other practices.
Thanks. I suspect there is not, but I just thought I would ask because I was curious.
So I think we had, Ben, just a couple of them that we had clarifying questions before we'd proceed to a contract and finalized approval. But directionally, beyond that, is the council comfortable with proceeding with the recommendations with a few additional questions?
I am I am supportive of these recommendations. And one of the things, and maybe this is an entirely different conversation, but really again looking at that geographic distribution and how can we, what organizations are we supporting to the east, and if there aren't that many applications we're getting from Eastern folks, like how do we help support those groups or groups that function in the east to help apply for these types of grants.
Or do the applications we're receiving, are they overlapping with the heat map we have of need for that we have high use and treatment?
I think they specifically our focus for this round was on those services that did not exist, period. But Ben does have some overlap with services and service areas, and there are some maps with data that show service area. So I think I would put that question, I would ask you to put that question into some data reporting back out where we have that instead of mixing that into the decision for approval for these contracts.
Correct. Not contingent for today.
Right.
Yeah.
And then let's put that into some of our focused questions for the next, for any intermediate cycles and for next year's cycle. Let's make sure that we add a geographic component to that. And again, that's going to be based on heightened impact and based on ability to serve. And I think then the place that we'll have some of the current data answers on that are some of the programs that specifically have mobility built into them, vans and services that are mobile.
Exactly, yeah.
But I think that's an excellent lens and factor to add to what we're considering. Okay, so given the hands, the thumbs up, let me ask for, and I see a check mark from Tim. Let me ask for a motion to approve this recommendation with the quote, with the specific questions that we've put in place.
Also move.
I'll make that motion.
Excellent.
Or I'll second that motion.
And I heard Tim second as well. So any of those in favor indicate thumbs up, check mark, or a yes.
I don't know if am I voting or no? I think, are we both voting?
I think.
Yes, you're both voting, and Doris is voting.
Oh, we're both voting.
We're both
the
voting.
chief is voting.
Okay.
You each have a vote on this one. I saw the chief's vote,
Peter.
so and I don't see any voting members who have indicated opposition. So that will be our decision. Let me just make, so we are approved on that set. Let me just give the procedural piece next, that will come then to the county attorney will be preparing all of these contracts, and then it will come to the county commissioners where we will present at a study session for the county commissioners this process, what the recommendations are. And then it will go on to, usually it goes on to consent agenda at a county commissioners meeting. And then, of course, because Adams County as the fiscal agent is the other party in those contracts, you'll get each of those contracts separately and usually on consent agenda in the future. And did I miss anything, Ashley, in that process?
No, that was a beautiful summary. Currently, we are slated to be on the study session agenda for July 1st.
Okay.
Yeah, this sounds like there's a lot of business happening. So that was the earliest, but we're excited. Ben, can you
Then you
confirm
get
that?
to listen to me again.
That is correct.
Great.
Okay, so we'll put those hands back in, and then we'll also instruct RMP to go ahead and send the not this time, but here's how you can have a stronger application in the future to those that we are not funding at this time.
And then we will send up follow-up materials, including everything we talked through today, the decisions that you all landed on, all of that good stuff. And for folks who have tuned in, we will make sure that this is recording and the decisions that were captured today are made publicly available per the Sunshine Law on our website.
And then we'll do an electronic vote on those that we asked for clarification before approving.
Correct. And we will, our other action commitment is to make sure when we bring back the data about program impact to date for grantees, we will also bring that information about the geographic distribution of these dollars too.
Excellent. Okay, we'll blame running over 1 minute on Kathy Henson for coming in 3 minutes late. And beyond that, we are adjourned for today, having exhausted our agenda. Thank you all very much for putting in all of the effort and attention and focus. Thank you to all of the folks from the public who were able to observe. We appreciate you being here. And thank you to all of the applicants. I think there's tremendous work being done across the county. Anything else I've missed, Ashley, Ben, before we say goodbye?
Nope, that was great. Thank you, Peter.
Thank you all very much. We appreciate you being here.